Hey guys, Dr. Darren Grollo, chiropractor, Bolton, Ontario. Back pain. Obviously, lots of different causes of back pain. But one of them that we find quite often is what's known as a spondylolisthesis. Now, that's a pretty strange word, so let's just kind of describe exactly what that is. Here we have a model of your spine. All the different bones, the spinal cord with the nerves branching out at each level, and the discs or the shock absorbers that are located between each bone. Now if we zoom in on the base here, I have a smaller one here that we can use as a model, and it'll make a bit of sense. So what should happen is that the bones should of course line one up over top of the other. You've got your nerves coming out between the bones, there's an opening that's created between the two bones where the nerve can pass through, and the disc between which offers that separation. At the back of the bones we have little joints that act as a stop block, which keeps the alignment of the bones one over top of the other and stops them from moving forward and backward. In the case of spondylolisthesis though, those stop blocks, the little joints at the back, they fail to perform their function, and what ends up happening is that the top bone will slide forward over the bottom bone. Immediately that narrows down that opening between the bones, and you can see that it's going to create an awful lot of pressure on the nerve and therefore the symptoms that would be associated with a spondylolisthesis. So that shifting forward of the bones is what a spondylolisthesis technically is. Can happen for different reasons again, and there's different ways that you can try and deal with this type of scenario depending upon how far the bone has slipped forward. And that's the grading system. The farther forward it is, the higher the grade of spondylolisthesis. And obviously at each grade, that will dictate the type of action steps you can take in order to try and deal with it.
Here we have an X-ray of an individual suffering from spondylolisthesis, in which you can easily see the shifting of the bones above on the bones below, or in this situation towards the left, at the level indicated by the black arrow.
So hopefully by visualizing this you understand a little bit more about what a spondylolisthesis is. Now if you have any questions, feel free to go ahead and leave them in the comments section below the video, and I'll do my best to get back to you as quickly as I can. Until next time, take care.